Now, with just 11 days to Christmas, recent figures from the Nigeria Center for Disease Control indicates that Nigeria may have entered the second wave of the coronavirus pandemic. A number of high-profile Nigerians have also come down with the disease, including the death of a general. The director of the Nigeria Center for Disease Control and the Presidential Task Force on COVID-19 are asking Nigerians to take their safety more seriously and abide by safety guidelines so as not to reverse the gains the country has made in the battle against the deadly virus. Joining me in the studio is Dr. Tuime Bawandu, a public health specialist and CEO, Medway Health Limited. Good morning. Thank you for joining us on TVC Breakfast.
Thank you.
Now, since the beginning of December, Nigeria has recorded an increase in the number of cases. And just last Friday, it was reported that we recorded the highest number in a day, I think on Friday, of over 700. Yes, in one day, and a lot of concerns has generated with regards to that figure. Even before December, the government have been talking about the chances of we entering a second wave, especially when we reopened the airspace. As it is, what concerns do you have or do you see? Because in recent days, we have recorded some deaths with regards to this new rising cases.
We're not actually doing enough to curtail this second wave. Probably we've entered the second wave even before now, and we're just seeing the effect of the second wave.
On whose part are we not doing enough now, the government or the people?
Both. Right. Okay, let me just break it down. Now, in recent time, we've seen actually, the exposure to what we call a super spreader events. Right. We open school, we open market fully. Churches are going, mosques are going, everybody's walking around with that. And then there's a lot of rumors surrounding the COVID, whether it is real or not real, whether it is gone or not gone. And then what has happened essentially is that people lower their guard significantly. Now, you remember, we just left the NSAS challenge, and then that was a very, funny event that can actually cause a lot of spread of that virus. So as these things were coming up, interaction is increasing. Definitely, we're going to have this kind of numbers. And it's not surprising. You are not saying that quite a lot of people, including the top people, the state governor, one of the generals, how many number of generals now? About 28 of them are in isolation. We've tried to fight banditry somewhere and fight Boko Haram. 28 generals are in isolation. We can see the connection between health and security. Right. And it's very key for us to understand this dimension. So on the part of the government, of course, we step up the information. It has become a repeat, a tired repeat. Put on face mask, put on these things. But we should have taken a little bit of step further to ensure that these masks are put on. What are these kind of steps? Now, we can deploy some of these brigades to the market. If you are not putting on your face mask, it's just instructed to put it on. I'm not saying you go and arrest them. Because if you try to arrest people, what purpose would that serve you? Tell those brigades, please put on your face mask. If you don't put on your face mask, we'll exit you from this market. So just people to guide them and ensure that the face masks are put on, and then the requisite number of people that are supposed to be in that assembly are there. In all those entertainment things, also the same thing, we must have a way of implementing that face mask. Don't let anybody be deceived that there's a vaccine somewhere. We are not ready for vaccine.
But the government is looking at vaccinating about 20 million people. That's what the statement last week that the government is saying. Who
made the statement? Where would they get the vaccine? Look, even America can only get vaccine for 50 million people. Okay? Because Pfizer told them that, wait a minute. We're going to produce 100 million vaccines. The Pfizer vaccine is 2 doses. Right. That's for 50 million people. We cannot produce the next one until summer. So you can imagine. Now, when this thing comes, there's politics of the vaccine. It has to go first to those countries that have the money, have the means. Nigeria cannot even deploy polio vaccine until they got help. They cannot deploy yellow fever vaccine until they got help. And they want to come and deploy COVID vaccine that you have to store under -70.
We might also get help.
Under -70 degrees centigrade. Where are the human resources? You cannot even, listen, how many people do you have that can do? Because the vaccine has its own challenges as it is.
Right.
Some of this, it's not necessarily that it's not going to work. Okay. Now, it's emergency use authorization. Okay. If any drug is under emergency use authorization as described by FDA, it means that it can still be withdrawn. Hydroxychloroquine was under emergency use authorization. And then the big issue is simply this. Vaccines don't save life. It's vaccination that saves life. Okay? Now, and there's a huge difference between vaccine and vaccination.
Talk to us about it.
Okay. Now, effective vaccines. It has to go through a process. One, acceptability. Now, there's been a lot of challenge to science, either from the religious organization or political institutions that are actually describing and demeaning the vaccine every blessed day. And there will be reluctance of the people to pick those vaccines. I explained that at this point, we must be narrowing our discussion to say that, guys, how do we ensure uptake of this vaccine maximally? Okay, and then in some part of Nigeria, they've not had good experience with vaccine.
Absolutely.
So the government is not stepping up that campaign, even if the vaccine comes. Okay, that this is how we're going to deploy the vaccine to everybody. Now, secondly, there are technical issues involving the vaccines. Now, it's a vaccine you are using under what we call emergency use authorization. Okay, you have to pick up a lot of data: the dose, age of the people, pre-existing condition. If somebody
how it interacts with all of this.
Then, for instance, if somebody had COVID before, or if somebody takes this vaccine, can the person still transmit COVID?
Which is a major concern.
Critical issue.
And if there is need for
Nigeria
another
is
dosage.
not discussing this, they're just talking about vaccine. Who spoke about the vaccine? I heard it was Ngozi Okoje-Iweala. Tell me, where does she have authority to pick vaccine from? Okay? And these things are expensive. Nigeria cannot even deploy anti-malaria. They're talking about vaccine. The best thing for us now is to sit down and focus on our face mask,
preventive measures,
hand washing, social distancing, avoiding
which has also
crowd.
had some of its challenges, like we have always discussed on this platform, talking about hand washing. A lot of environments or societies do not have the basic, tap water, borehole, and all of it, to say that they need to wash their hands. All of the basic amenities needed to address these issues are not readily available for some of these
These are the cheaper intervention you can make, the government can make. Now, yes, we have our own rules to pay. Because, again, first and foremost, you don't want to pick the virus. You don't also want to give to another person.
Absolutely.
So why on earth would you not want to put on a face mask? Okay? Now, at least, why would you want to go to an event and then continue your magical thinking? God is going to protect me. It is a miracle. Where do people get those kind of thinking? It speaks volumes to the quality of education we're having in this country. If somebody who is educated, who's supposed to understand direction, will tell you that, no, don't worry, I'm covered by the blood of whoever. So, well, that is where we are. Now, for me, that is area that government can spend money on to push education, to support hand washing, to support face mask. Wait, supposing at the entrance of Tejo Market, for instance, or Kubwa Market in Abuja, you have a portal for dispensing, for picking face mask, okay, that people can then use. Say, please, you are not having face mask, please take. And then at each entrance, there are people looking at them, please put on your face mask properly. That will help a lot. Apart from the fact that you are trying to create small job for some people, it will help. Those are simple public health intervention that can be done that will make a difference.
But some say that the government cannot do this alone on its own, so perhaps a public-private partnership, which we saw over time, but that also stirred up some conversation and controversy as well.
Somebody should tell me in this country, what is government supposed to do now? Government cannot provide water, public-private partnership. Government cannot provide road, public-private partnership. Health, government cannot provide public-private partnership. Then tell me, what is government supposed to do? Okay, well, you see, health and education, they're just two basic things that any government should look into and deploy money and deploy energy to, so that, again, we can have nice conversation.
Absolutely.
Because, wait, you fall sick in this country, you are on your own. You can't get anything done. Even the simple preventive measure, why should that be difficult? Tell you what, even the mighty Britain, the big America, the huge India with all that, they're having a problem with this virus.
Absolutely.
Where do you think, listen, I can tell you the number of doctors in each of these geopolitical zones in Nigeria. I can tell you the arrangement of the health workers. Where will you get them now? Okay, you want me to come and be running around looking for how to fight COVID? It's going to be difficult because the only thing that can make sense is when government say that, listen, we're taking the next step. Look at what has happened to our generals. Look at what has happened to the governor. Okay? Well, I wish all of them, quick recovery. As it is, we don't want anything to happen to them. Because they are good, they're top there, they can then have access to quite a lot of things. Mm-hmm. And even, how on earth can you now test 840-something thousand out of 206 million people, and you think you're doing work? We're not, let's don't pretend. Let's not just act up.
But let's look at this issue critically. The COVID-19 began sometime last year, and it's over a year now. A lot of persons are saying that at this time, shouldn't we have learned enough about the virus to ensure that we get a cure, perhaps, to deal with the virus once and for all?
Why you are looking for a cure? Developing drugs is not that easy, okay? And viruses are very ubiquitous organisms. They are neither here nor there. When you are looking for a cure, prevent yourself now. Okay, we cannot get cure. We've been trying to look for a cure. Okay, we're looking for drugs. Yeah, there are a combination of drugs that could be really good, okay? But not in our environment. They're expensive. In our environment, they're expensive. And the vaccine comes out. We don't even know how long the vaccine is going to protect anybody.
Absolutely.
That will be another thing of study. Is it 2 months, 6 months, 1 year? We don't know.
So the vaccine in itself is not a cure. That has to be established.
Again, like I said, is emergency use authorization. That is where it is. Now, we're not even thinking how do we engage this vaccine. I'm talking about Pfizer one. Maybe when the Johnson & Johnson one comes, AstraZeneca's one comes, or Moderna own come, then maybe it's going to be a bit better. Who knows? But I can tell you that even National Program on Immunization is a huge burden for Nigeria health system. You have to look for support here and there, and now you're adding COVID to it. So I think for everybody, that point of responsibility must be there. In the past 9 days, more than 5,000 new cases in Nigeria.
And it's the festive period.
Yes.
And a lot of people are even also coming into the country, which was one of the ways that the COVID-19 was spread across even countries as well.
And then if you look at the quality of your test system, I have a friend's wife, he tested positive, negative, positive. The lab guys are just not doing enough.
So that's also creating a loophole.
Yes, I don't speak rumors. These are facts that people have to confide in me. The husband is negative, she tested positive, negative, positive. Sort of, funny thing. There's no trust. Why should we now corrupt every little thing that's supposed to advance us? Every damn thing. How can you corrupt health? How can you push falsehood? The falsehood in terms of information management, the falsehood in terms of various claims. You are testing 40-something million, 1,000 people in 206 million people. How does that reflect what is the true picture in your country? So what is wrong in strengthening the primary health system in such a way that it can become functional? If we address our greed, these things will work.
Really? That's what is at the heart of all of these issues?
If we address our greed, because again, a lot of money we don't need. A lot of money we're pushing we don't need. And look at even the connection to security now. How on earth, that we're at the midst of this kind of banditry and Boko Haram insurgency, and we're having that high number
of generals,
of top-notch people that Nigeria has spent a lot of money to train. Now they are under isolation.
Being infected.
So what are they going to do? We want to take them to the war front. It's not going to happen.
Now, let's quickly look at the preventive measures again, because some persons might have forgotten what they are. So I'd like for you to speak about them again, talking about hand washing and all of that.
Guys, we know that this virus is a respiratory virus, okay? The first thing you want to do is to keep your hygiene. Wash your hand properly. Secondly, wear your face mask. Third, avoid crowd. If you don't have reason to go out, stay. And then when you are in the high-risk group, above 60s, pre-existing condition, hypertension, diabetes, immunosuppressed, on retroviral drugs, you have to, again, be more careful about this thing. And then when you feel the symptoms, as much as possible, confide in your health system so that you can get help.
The symptoms, we need to talk about that as well.
Now, it's like general constitutional symptoms. Somebody's running fever, weakness, body ache. That's the first stage. Then later, the person can now have sore throat, okay, dry cough, okay, difficulty in breathing, and then the thing can progress and affect so many organs. Because coronavirus is a multi-systemic infection from head to toe. And then we're even talking about post-COVID syndrome now. That means that even after someone might have been cured or seen negative for the COVID, there are other conditions that could still happen.
Really?
Because of the immune system that was evoked. Yes, absolutely. The heart, the kidney, the many organs in the blood can still be affected. Some have depression, some have amnesia. So it's a complicated thing. So it's better for anybody to run away from the thing and not actually have the COVID. It's not just saying that I'm negative. It doesn't stop there, or I've been cured. It doesn't stop there. There's a new thinking on post-COVID syndrome. Quite a huge number.
This is quite complex, and like you have rightly said, prevention being better than cure. And as it is now, the Christmas period is upon us, and a lot of people will be mingling with a lot of persons who travel in from outside of the country and those who perhaps are traveling various locations across the country. Prevention really is better than cure. But one thing I want you to harp on again is still the aspect of this vaccination, because a lot of people say that once we have that, a lot of problems have been solved, because there's still information that it is not clear.
It's not a silver bullet.
It's not clear, and we need to really harp on that for people to understand why they need to prevent it in the first place.
Yes, because number one, if the FDA says that emergency use authorization,
yes,
it has not been approved. Let's get that straight. It has not been approved. Emergency use. So now, what then happens is this: because we've looked at the potential benefits, of using the thing when compared to not using it, risk and benefit. It's okay. Now, this number of people are dying every day. This one we've seen it to be 95% effective. In fact, Dr. Fauci was actually thinking of, if we can get a vaccine that is 60% effective, we should use it. But they have 95% effectiveness. Okay, let's use it, because we need to stop this death anyhow and reduce the number of people coming with COVID. Now, after approval for that emergency use authorization, do not deploy the vaccine. That one is a different thing entirely, to make sure the vaccine gets to who gets it, how does the person get it, how do you record side effects. That's a huge issue.
Another study on it.
In a country that is organized. Now, in Nigeria, we don't even understand what is. We don't have means of saying emergency use authorization. We just want to pick something and use our own. It shouldn't work that way.
Right.
It shouldn't work that way. Secondly, the method of deploying the vaccines, you are looking at minus 70 degrees centigrade to study. How are you going to get that to a village, say, in Papado or whatever?
So it means we should be looking for homegrown solutions at this point. Beyond the preventive measures.
Listen, the homegrown solution, we've been looking for homegrown solution for malaria. We have to still go to China and get artemisinin-based drug, So for me, if you put a lot of effort in looking at prevention of diseases, okay, then we are left with a little number of people that we need to treat.
So if you have to be specific in terms of preventive measures, attention that government should put in, what would they be, the effort that government should put in terms of speaking about these preventive measures that would have that impact and people take the message seriously?
For me, you see, look, we have event centers, we have markets, we have worship places.
Yes.
Now, okay, I expect that at that level, we must be able to put some monitoring into those areas. What do you mean by monitoring? This face mask is not that expensive now, but it has become expensive now. So government can say, wait a minute, I'm going to put a face mask portal, okay? And people will watch people that are coming in and say, listen, you need to put on your face mask. And within the market, they look around. Don't arrest them, don't punish them. Just ensure that they put on their face mask properly. If they're not putting it properly, you send them out. Even, at least they put temperature and they put in a kind of sanitizer there. But we must enforce the use of that face mask, as a preventive measure.
Initially,
especially in an environment that encourages, interaction and spread of that disease. So then, we once again involve a lot of stakeholders. It seems government is putting a lot of things on itself, trying to communicate it. Unfortunately, there's a trust deficit between the government and the governed. So anything government says is not easily believed. But there's still power locals or loci everywhere. The head of this church, the head of that mosque, the traditional ruler of this place. You have to deploy some of these authorities to them to help you do a lot of things. If you do that, you see, they know that in their community, they have mandates to ensure those things happen. And then, in any community where you pick COVID, you have to do a countdown. So countdown means that, okay, wait a minute, we've seen in this environment, on this street, 1, 2, 3 COVID. What do we now? We have to look for more people, in that environment that may likely have COVID. We have to step up the preventive measure in that environment. So I know that trying to trace contact is difficult,
yes,
and complex. But you can do that kind of environmental, focus, countdown to ensure that at that point, you look further, you check, and then you measure. Encourage people to self-report, and then even be able to type and send to you, But I thought the other time we said we had, a rapid test for COVID.
Yes.
But for me, I'm still waiting for it to be deployed so that we can be able to test more. You cannot test 845,000
out of over 200 million.
Of 200 million people.
Yes.
I think you're working.
We'll leave the conversation here now. Dr. Tuyimi Bawodu, public health specialist and CEO, Medway Health Limited. Thank you so much for your time on the program.